Will this apply to ovulation pain also? Yes, to everything, to any kind of pain around the pelvis, typically female pain. So we now talk about different types of dysmenorrhea, and we talk about which are the commonest medicine for dysmenorrhea. I have exactly 30 minutes and I have to tell you the top 10 remedies that I want to talk, maybe not 10, maybe 20 remedies that I want to tell you about in dysmenorrhea. Can I go a little fast? Say yes. Like a rapid fire differential materia medica. Can I give you that? Rapid fire differential materia medica. Like like that. or else I, I'll be able to complete less because there is only 30 minutes and 20 remedies. Both nines are here. We have plenty of time to learn from your side. Yes, we have, but we have yeah. So this is a very interesting map that is created by Dr. Jaya. What we try to do is, how are the different pains of dysmenorrhea and which area it goes to? And this is very beautifully prepared by Dr. Jaya. So if you like it, you should go and thank her or maybe follow her on Instagram. So you can see here, dysmenorrhea typically where the pain radiates to the thigh. Xanthoxylum is one remedy. Another very important remedy is semicifuga. With this dysmenorrhea, when the pain, there is cramps in the calves, the remedy is colocynth. When the pain in the dysmenorrhea goes from here, from the pelvis, goes right till the feet, the remedy is scolophylum. See, this is a pictorial representation of materia medica. I always wanted to prepare this. I felt that different people have different memories. Like I remember at some point in my life, I wanted to learn the entire Boger synoptic key. So what I did, I took a phone and I audio recorded the entire Boger synoptic key. And then whenever I would be traveling, I would put that earphone on and I would listen to the entire Boger synoptic key. At the end of 2 months, even if you wake me up at 3 o'clock at night and ask me what is the first line of Nephrum muriaticum, I will just blurt it out. Because the whole Boger synoptic key gradually started going in my ear, then in the nerves, and then in the blood. So, I started thinking that there are different ways of learning. And I realized that I have different kind of memories, and so everyone has. So one way is definitely what we all do, like a visual memory. You remember a page, you read a remedy, and you remember, okay, it's written like this. The other way is audio memory. So that's where audio, video, you can use both. But the other way, which I'm very fond of, is which I always was something very close to me, which I wanted to work on, was pictorial kind of form of materia medica. And I don't think there is enough work done in the pictorial form of strategies for homeopathy. And that's what I'm trying to do, where the idea is pictorically, strategically, for a case of dysmenorrhea, just by looking at the picture, how you can remember different remedies. You can see pain going right to the feet, colophyllum. Pain extending from back to front, kalikab. Pain in dysmenorrhea going from one side to the opposite side, like diagonally upward, murex, like this. And then pain, dysmenorrhea drawing the groins like this. There is another remedy, tan acetum. And then pain and dysmenorrhea going to the throat. Can you imagine pain down going upwards like this? Bacillus angelsium. So this is a very, very interesting kind of pictorial form of thing. We are working on it. Let's see. Sri Sreen says, I am a good artist, sir. Please, can I help you? Sure, Sri Sreen, you write to me. We'll see where you can definitely contribute. Sure. Let's go ahead. Let's go ahead. But are you getting this kind of pictorial kind of picture of materia medica? Kiran Jones, right? I want to help. Sure, you write to us and we'll see if there is a possibility. Sure, anyone who wants to help, you can write to us, and I'll ask Dr. Jaya to go through it. So dysmenorrhea. Okay, now we are going to talk about different types of dysmenorrhea and the remedies here. The number one remedy in dysmenorrhea, belladonna. And I'm not going to tell you 100 symptoms of belladonna. How belladonna is throbbing, how belladonna is burning, how belladonna is sudden. You know all this. I'm going to tell you the main thing. If you pick up the main thing, you'll be able to prescribe, because all of you are, you know materia medica fairly decently well. But I want to tell you the clinical tips of different remedies. Just the clinical prescriptive points. Belladonna. The main symptom of belladonna, remember, and I've told you this before, that the menses feel hot. They tell that there's a lot of heat in the genitals. Belladonna. Second, always remember, every belladonna patient, every single belladonna patient, aggravated lying down. You ask the belladonna girl, okay, lie down. You are getting pain, lie down. She said, no, I can't lie down. If I lie down, it pains. Belladonna. You know the famous symptom of belladonna, right? Uterine prolapse better by standing. So they feel better by standing. Belladonna. And the typical sudden and violence that it brings with it. Belladonna. That's it. If you know this much, belladonna is good. Pain, erect posture ameliorate. Erect. Belladonna. You can see this. Single remedy. Okay. Posture erect ameliorate. Yes, also very high violent sexual desire during menses. Belladonna. Are you all with me? Are you getting an idea about this? I'm going to go a little quicker now with all different remedies. Yes? Kahan ho? Let's go ahead. See, this is such an important topic. Female, dysmenorrhea, PCOD, infertility, endometriosis, fibroadenoma of the breast, thyroid, obesity. These are very important topics. You want to know these indications. I want you to remember it forever. You will be able to help so many people through the next few years. It will be remarkable. Absolutely remarkable. And that's why we collect all this for you. There's a lot of research that goes behind all of this. Different research from different literatures, different clinical experiences we have put together for all of you. Let's go to the next remedy, Dalkamara. Again, Dalkamara is one of the lesser known remedies for dysmenorrhea. One of the main symptom, key symptom, the one very important symptom, during the menses, they start getting skin eruptions. They start getting skin eruption, boils. Very important. The women, they get herpes around the genitals. They start getting herpes, dry eruption, boils around the eruption, around the menses period, skin blotches, and they become very sensitive to cold. This is Dalkamara. During dysmenorrhea, skin eruptions and eruption around the genitals during the menses. That's it. That's Dalkamara. I mean, there is much more to Dalkamara, damp weather, aggravate, but I'm not here to tell you the whole story. I want to tell you just that clinical point on which I prescribe in the acute. Are you all with me? Are you getting this? How to pick up that clinical point? I'm really sharing with you all the clinical secrets, okay, of all the masters. When I'm talking to you, I'm not talking to you as Gaurang or your friend. I'm talking to you almost sitting on the shoulders of masters, of clinical masters, of the last generation, of this generation, of all the generations, of different literature, different authors. All right. So you want to remember this, what I'm telling. Nux vomica belongs to the Loganiaceae family. Nux vomica, as you know, is one of the most important remedy I use in dysmenorrhea. I use it more often than Macphos and Colocin. Typically, gastric affections are very important, but the main symptom I want to tell you, that is written by Minton, and you know that the Minton is the authority in female homeopathic literature, and she writes fainting with menstrual issues. So during the menses, they faint. Chakkar aa rahi hai. Chakkar aa rahi hai. I am feeling fainting during menses. Nux vomica. And always patient is very chilly, wants to be covered. They constantly want to be covered like this. This is typical for nux vomica. Uncovering aggravates nux vomica. And you know the typical symptom of nux vomica, where slightest anger can cause metrorrhagia. We go to the next. Viratrum album. Big remedy. Big remedy for dysmenorrhea. The typical Viratrum, we know the different manias of Viratrum, the religiousness, the sexual mania, the affectation, the slandering, the cheating, the fraud. You know, Viratrums are absolute frauds, liars. But in the acute, what to see in Viratrum? I'm going to tell you only two things. The number one thing is cold sweat on the forehead. If you see with the pain and you see on the forehead cold sweat, and they want to drink or eat something cold or have something sour, khatta. I want to have a sour mango. I want to have a sour jelly with the pains. Viratrum album. Let's go to the next remedy, a little lesser known remedy. The great remedy from the called as the beaver, the Castorium canadensis. Castorium. This is a very, very hysterical remedy, Castorium. And my experience with Castorium was where the Castorium patient had a very peculiar dreams where she's trying to scream, but the voice is not coming out, like magnesium mute, shrieking, but unable to shriek. Very typical for Castorium. But what is the symptom of Castorium? With the dysmenorrhea, there is a lot of tympanitis, which means there is a lot of abdomen swollen up, a lot of flatulence, gas, and a lot of hysteria, which means sudden change in mood. Castorium. Every remedy I teach you, you have to go back and read from Boric Clark Materia Medica. Is that okay? Will you do that? Say yes.